And for more, let's bring in journalist Michelle Lamb, who joins us now from New York City. And you know, Michelle, as bad as those numbers are, New York authorities have said the official death toll might actually be an undercount. Why is that?
Well, there's been lots of speculation why the numbers reported are not accurate. And some people are saying that some people just haven't been in the hospital. New York City, Manhattan in particular, there are several people with two residents. Their primary is here in Manhattan, and then their secondary homes are in upstate. So I'm assuming when they are making reference to there might be an undercount, there could be people who left the city with COVID-19 and did not know that until they got to their secondary residence, or there were some people who were not fortunate enough to make it to the hospital. We've seen that this virus has impacted so many different people, and there's so many different circumstances. There are some people who live in New York City alone and they don't have family. So each day we're learning more and more about the death toll.
You mentioned that, a lot of people have been going to their second homes outside of the city. There's been a lot of criticism and a bit of blowback regarding that trend. Individuals in those more local communities saying that the people from New York City are bringing coronavirus to them. In that context, how is the healthcare system in New York City and also outside of the city coping right now?
Well, right now, I feel that the city is working closely with the state to pool their resources to basically put together a more effective plan. When we first heard about the first case, the person who worked in the medical care facility, she came in from Iran, and she self-isolated. And then from there, we started seeing numbers growing gradually. In the beginning, most of us here in New York really didn't know what to do. Should we wear a mask? Should we not wear a mask? And at first we were told not to wear masks, then to now wear them to help reduce the numbers. So I think how they've come together in different areas is, you know what, everyone wear a mask as a precautionary measure, and each city is taking the steps to protect their citizens.
The National Guard troops have been called in order to assist in dealing with the coronavirus. What is their role going to be?
Well, their role is to basically help with separating those patients with COVID-19 and those who are just going in for regular medical treatment. The hospitals quickly began to fill up. Some people, when they hear what the symptoms are, and we're, in the season where people have symptoms that are just, common cold or flu, or maybe it's allergy season, but they're like, wait a minute, do I have COVID-19? So just to ensure that we can keep the numbers low, they have the National Guard helping to separate. And they've also set up temporary hospitals, if you will, in Central Park.
Michelle, just briefly before we go, everyone, is under this 2-week stay-at-home order now. How are people coping in what is usually one of the world's busiest cities? I mean, if you look on social media, for example, you have these hashtags which are trending, such as New York Tough. What's the mood?
New York tough, stay inside. People are just basically reaching out to each other using video chat to just stay in touch and make the social distancing a bit more bearable. I live right by Central Park, and about 7 o'clock each day, everyone goes to the window, we cheer, we clap. And that's in support of, the healthcare professionals who are risking their lives. But also when you look across the way and you see a neighbor that you haven't seen before and you wave and you're like, okay, well, they're here today. It's kind of like a ghost town when you look down a street that's usually heavily populated and there's no one there. So this moment where we're encouraging the healthcare professionals, it's also giving us a glimmer of hope.
Michelle Lamb joining us from New York, where there is some evidence at this hour, even despite its deadliest day in the coronavirus, that the curve might be flattening. Thank you so much for joining us for that reporting.
Thank you.